You're live.
Finding good stuff. All right, we are February 26th. We are 2 days in front of town meeting break. And we are first talking about S-263, and the sponsor is a member of this committee. And we asked him to sit in the witness chair, and he said he liked it where he was. So I think we're
Much more.
going to go from there.
Thank you, Chair. This is S-263, an act relating to the use of automatic traffic law enforcement, ATLE, was by municipalities. And ATLE, I think it's important for folks to know the difference in ATLE and license plate readers, because people often think of them as the same thing, but they are different. There are license plate readers that law enforcement had at one point in Vermont attached to their patrol cars.
Oh.
That would automatically just read the license plate and then find the information, and they would be like right there on their screen. And it's just collecting data as every car drives by, or as the patrol car drives by. You could have stationary license plate readers or on patrol cars. We have law enforcement. I think the Essex Sheriff is the only law enforcement in Vermont that still has license plate readers. And at least last time that we looked at it, I don't know if they're still using it. But we had a lot of rules and a lot of discussion about public safety around license plate readers and where's the data being stored and all this thing. So after that, we had a lot of testimony in here about accidents at work zones. And we had a death one year. We had this room full of flaggers and a mother of the guy that had died, hit by a car. People saying they had to like leap into ditches away from cars.
Yeah.
So the AOT had proposed to do automatic traffic law enforcement because we heard from others. Kind of like this year when we did different states on what they had done with them. We did that with automatic traffic law enforcement. And there was really positive reporting specifically for work zones or specific speeding areas. If you set it up and have the camera and the signs, that people slow down. And especially after they got tickets in the mail or even warnings in the mail. So we were going to do a system of three work zones where you would do it as a pilot. They were going to use, the traffic safety money that they had to do the pilot. The governor signed the bill. There was some support for it. But when it passed, there was a misunderstanding about what law enforcement would write the tickets, because you still have to have a sworn officer view the video to write the ticket. And the difference between ATLE, back to the difference between ATLE and license plate readers, is ATLE doesn't take a picture of every car that goes by. If it's for speeding, they will tell if the car is speeding and then take a picture. And it'll only be a picture of the license plate. It won't be a picture of the car, so you don't know who's driving it. But then the law enforcement officer has to say, yeah, that's the license plate is the number that the computer said it was. I'm hitting the buttons, and that person gets either a warning in the mail. And then when we set it up for the pilot, it was going to be warnings for a while, then it would be tickets. But because after we passed the bill, there was a disagreement about what law enforcement would do. The troopers, although they had testified in support of the bill, didn't ever say they were willing to put an officer on charge of looking at these videos or images, although we didn't think it would be that much time, that they didn't want to commit to it. And then DMV said their sworn officers didn't have the time to do it either. So even though we passed the law saying that they would do it, they just didn't do it. Because they said they could find the law enforcement to do it. So, but after that, City of Burlington expressed an interest, and they've had issues with not only speeding, but red lights. And to the point where it was very concerning about how many people were running red lights. So they wanted the permission to do this. So this is kind of where that bill came out of. Like, if the state's not going to test it out, if a municipality wants to do it, it gets a vote by their citizens. So it wouldn't just be the select board or the city council. They would take it to a vote of their own citizens. And citizens are willing to have cameras for, this allows for work zones, areas that have increased instances of crashes or speeding at traffic signals. And then it also allows, if they have a municipal sound ordinance, they can use a sound camera. But this just basically allows municipalities to go ahead and do it and report back. The reporting in here,
And the ticket goes with this.
yeah, and they could do it as, they could do warnings or tickets. It would be a municipal speeding ticket. It would be the same ticket as if you got pulled over, but it would be sent in mail. We worked with ACLU, who was supportive of the bill when we passed before for the work zones. Because the way the data is being collected, the way the photo is only being taken and it was being deleted after the ticket was being issued. So a lot of the language in the bill is from that year that we had the pilot and work zone. So there's a lot of existing language that we'd already worked about how this is going to work and how we can do it to preserve Vermonters' privacy. The thing that's still in here that I heard from AOT is there's a report from AOT about what areas they've done ATLE and kind of the reactions. But since this is just be done by municipalities, they were like, well, we don't want to do this report if it's not AOT cameras. So they said they would be neutral on the law if we took out that part of them doing the report, but otherwise they're okay with it. And they even said that they would be okay with going back to the highway work zones if we could figure out the law enforcement piece. They're not opposed to that at this point, but so that's the thumbnail sketch of it. Happy to answer questions. The chief of police of Burlington was supposed to be here to talk in favor and why they feel this is important. Unfortunately, he's ill today. So if we want to have him back or the law enforcement, we could do that. And I know we're approaching crossover. It wouldn't need any other committees, although I could see because it allows the town to do this without getting their charter approved, it just allows them to do it. Like ops might want to look at it, but I'm not sure about that. But so the basic thing is it allows municipalities to use automatic traffic law enforcement in their own towns on their own roads by approval of their own citizens. And we just kind of let's have the state get out of the way.
You don't think judiciary would want to see it?
They might. They saw the original bill, but it's a good point. They might want to look at it again. It's a different judiciary committee than it was when we passed it before.
I absolutely hate to bring this up. Because there are a number of communities that want their speed limits adjusted in their communities, and we're facing that. And it brings up the whole other issue. Do you think the pressure is on for those type things, this type thing? Because we're seeing enforcement of traffic violations drop so dramatically.
Oh, 100%. Yeah, that's, yeah.
I think so. And I think a lot of times the towns that want to lower their speed limit, they think that'll help the speeders. They're like, well, what can we do about these speeders? This would give them another, so they wouldn't need to lower the speed limit. I think they'd be fine if people were just following the speed limit. But if it's 30 and people are going 40, they're like, well, let's lower it to 20 so that they go 30.
But yeah,
That's my feeling about it. So I think some of that pressure, I don't think it would.
how expensive is this equipment?
I don't remember. You basically hire a firm. You know, you have a contract
And
with a firm.
are they accurate?
Yeah, they're accurate. They're kind of like the radar guns. They can be calibrated. There's language that we had from before about calibration of it's basically a radar gun that's connected to the camera that's measuring the speed. So it's almost identical as a officer pointing a radar gun at your vehicle. That's instead of the officer reading the number and writing a ticket, it takes a picture and then sends that to law enforcement. And so in this instance, it would just be to the Burlington police, and the Burlington police would have an officer look at the images. And then again, they're only taking an image if the car is speeding. So it's not like they have to look at 1,000 images. They just have to look at the ones that were tagged as speeding. And you can set the parameters. When we did it with AOT in the work zones, it was going to be only for cars that were going 10 miles an hour or more. But you could set it at 5 or at 15 to take a picture only for the super speeders or something. And you could also set it to send a warning.
Would this be only on state highways? You read the list.
I assume this would only be on
I'm not,
municipal roads.
this is not, I'm not, this,
It has, you have it broken out between those work zones have different rules than the other ones, if I'm understanding your bill correctly.
There's since it still has the AOT language in here, if this allows the agency to do it, if they can figure out the law enforcement, they've told me they're not going to do it. But it's selected by the agency for a highway under the jurisdiction of AOT or a highway under the jurisdiction of municipality.
not having,
And they have to have.
I think this is not meant to be argumentative for anything, because I can totally see in certain instances this might be good. We have a number of towns in the state that back through the years have hired some law enforcement people that have wanted to make money for their towns. And they put people in the most inopportune places. And I would hate to see a community set on some hill where you know that I want to be careful about how we did this.
Yes, I understand the concern. I mean, right now they have to have an officer there. This would make it easy for them because they still have to pay for it, but could have a camera and just be.
This would have to,
But it would have to be on a town highway. So it has to be on a highway controlled by the municipality. So they couldn't do it on state highway unless they had state approval.
that doesn't, the communities that have been pressuring me and they have a main street that's right on a state highway.
Yeah. They couldn't do it if the state highway goes through the town. It has to be on a town that the municipality is the controls or is the whatever that legal term is. So they would have to get approval from AOT if they wanted to do it on state highway. So it's on a highway within the jurisdiction of a municipal law enforcement agency.
Okay.
So they would have to, and then have to go to the town voter. So if it's on a town road, which you would think would be mostly town people, they would have to vote for it. So you have to get a positive vote by the people. So they're kind of voting like, we will do this. There might be instances where if there's a town road that's a main thoroughfare and somebody could abuse it to put it 1 mile over the speed limit and just send everybody a ticket to try to make money off of it. I think we could either address that through an amendment to the law or,
Well, I think
report it back.
this is going to take some testing.
Yeah. And I was hoping that we could take it up. Okay, because I think it is a safety issue and the committee expressed safety as a top priority. If we have time and since a chunk of this is already passed, if there's an opportunity to put it in D-bill, which I think of where it was originally, or maybe it was in a D&D bill. I can't remember, but I don't think it was a separate bill when we passed it.
Okay. Go ahead.
Thank you. I'm supportive of this effort for sure. I mean, we know that speeding is causing lots of problems. So I'd like to take it up and I'd like to get into more of the details about just making sure that it can be effective, because just in my area, it's the state roads in and out of town. I mean, you're always in a town, right? There's not a place where you're not, but in downtowns,
Yes.
as well as the outer areas.
I'm going to go to a town meeting and they're going to their select board is voted and they're at odds with AOT because it's Route 15.
Right, right. And then just for pedestrians also, you know, pedestrians and bicyclists, and we've had a lot of those and our rates are just as a country going higher. So I'd like to take it up.
Yeah, I'm really excited about this bill. I've been following this topic. I like the story arc you gave because it reminded me, we have been talking about some slice of this exact issue for the whole time I've been in office at the state level. And we have tried so many different attempts to either give the tool like this to communities that are in need or have the state be able to operationalize it for their own projects. And it just hasn't happened. And so I really think this is a elegant way to resolve a need that I've been hearing for the last 8 years. So I'm really grateful that you introduced this bill. I think if we are to take it up, I think we should hear from like ACLU, and to Senator Brennan's point, maybe that's what judiciary wants to hear about. I think the conversation has shifted since we had that conversation a few years ago, where we are now on camera, being recorded. All of the culture around that has shifted pretty significantly. And when you go through a toll booth now, you're not paying someone, they're taking the same level of information that this would be. And so I think that there's a different conversation that could be had. So I don't see it as much of an issue. But I appreciate that you took some due diligence to look at how is the data stored? Because my big concern would be that the federal government would use that data against people who they deem to be risky,
Right.
whatever that flavor of the week is now with Donald Trump. So that's one piece I'd like to spend time on, and I'd love to get the ACLU's perspective on it, whether it's here or in judiciary. And then I want to know more about the sound camera piece, because we passed our noise pollution prevention bill. It's stuck on the wall from outside, but I know multiple communities that are wanting to enforce already existing ordinances and have. Let's see, Pat. You got one more. Then it's 3.
I can go more than that.
But the sound cameras were the main tool that the different advocacy groups had noted to us. And what we heard from the state was, oh, we don't want to buy them. They're too expensive, essentially. That's why we can't do it. So if a town is really dealing with it and wants to enforce their own ordinances, by golly, this could be the way to do it. So
Very interesting. The sound camera technology is pretty interesting. We could have people come in and talk about it, but again, it just allows municipalities
yeah.
to do it if they want to do it. We don't have to do it. There's also as a field, in case people are worried about this kind of being a runaway train. It's in 2029, so they would have some time to do it. I don't know if that's the right date, but it would, we have to, the legislature would have to actively extend it to keep it going.
Oh. Can I just say one final point of process? I think this should be a priority bill for us, along with super speeders. I think both of those answer like the safety conversation we've been having. And I hope that we could consider either of these in the T bill rather than as separate bills, because I do think there should be life beyond this week for this bill. And I'm wondering if we have the ability, or if we know if the House has a vehicle other than that that's coming over. A point.
At this point, I think we're gonna move on. Yes, Caleb, maybe.
Let me check. Oh,
Hey, look,
right
right
there.
Cute. I brought friends. Okay.
Cool.
I'm leaving now.
Come back here, come back here.
Wherever you want.
That's the lawyer.
That's Joey Pistol.
Oh, wait, come out.
I sit all the time. I'm a frequent visitor, so I don't get.
No, there's another, there's chairs over there, in case, so 2 of you want to be.
Caleb, I think you're next. Yeah, it's 9:30.
Yeah, good timing.
Um, that's okay.
Oh, yeah.
Sunny out.
Never.
It's sunny out.
Yeah,
Kind of.
yeah. No, it makes a difference, isn't it?
Mhm.
Yeah. And
So-
24 degrees.
Caleb's here. The question I asked, of the public transit agencies, we did the effort last year to put in, money and, create an effort around volunteer drivers for, medical transports. And, we, um, we touched on that with health and welfare down the hall, but I think what we need to hear is specifically exactly where we are, where that effort is, what will it take to continue that effort on into next year. If we're facing a year where January 1st, we're facing significant Medicaid cuts, and there's a contraction of medical services around rural Vermont. We can't offer medical transports without people. So the effort we started, I think we're gonna want to make sure in this committee that we find a place for the continuation of this effort and at least continue it at the level that we started, if not grow this. And so I asked Caleb to come and talk to us about where we exactly are, what do they need, what can they accomplish going forward, and put in front of the committee. What are the opportunities for us to do that? I will frankly tell you, from my point of view, it's scary, the thought of losing services. My local hospital voted this fall to end births. And if I have
November.
Yeah.
the births at the hospital,
Well,
They
but
don't have
the
that.
Burnley Center.
it's an interesting thing because all of the services up to the birth could still be done in the community. But the coordination of all of these services is vital to people being able to get to a point.
Yeah.
So if you could help us understand where we are and what we did, and how to move, how would we move forward with this, and what are the options?
Thanks, Chairman. For the record, Caleb Grant from Rural Community Transportation, Chair of the Vermont Public Transportation Association. Thank you for the opportunity to follow up on the investment that you wisely made in volunteer recruitment across the state. Let me first begin by framing the value of the volunteer driver program. RCT has proudly been one of the state's leaders in volunteer recruitment and providing services. So on any given day, RCT will give anywhere from 900 to 1,200 trips. Typically about 600 to 700 of those trips a day will be done by volunteer drivers. So building out capacity while maintaining a workforce that is resilient through fluctuations in demand, volunteers can be critical. The other value of volunteer drivers, often you'll find they are the least cost option. My kind of pushback on that is, volunteer programs also come with a great deal of administrative burden. I'm joined today by our volunteer coordinator, who I'm hoping you'll be open to hearing from later to talk about kind of the ground experience of that. But one of the greatest values of volunteer drivers outside of the cost savings of that lowest cost option. As a reminder, volunteers are reimbursed miles. We do not pay volunteers. they're reimbursed for their mileage at the federal rate, which is constantly increasing. So if you ever see our hands thrown up and say we can't control costs, oftentimes it can be federally determined rates. But with the consolidation of healthcare services across the state, volunteers have become a critical aspect of that. At any given moment, we'll have 2 or 3 drivers at Dartmouth, at Boston, at UVM, or in Albany. And if you send an RCT professional driver, you're taking both that driver and the vehicle out of circulation for the duration of the day. So when one driver may do 40 different trips in a day, if they're taking one trip to Boston, that can be detrimental. But if you can satisfy that with a volunteer driver, that cost can be controlled and you can maintain the vehicle and the driver within the system. So that's kind of a general overview of the value of the volunteer program. Where we saw the impact of the $600,000 investment was it differed from agency to agency, and Ross McDonald's here from VTrans can help give a better overview of where those specific funds went into. But we as agencies did have to make a strategic decision for what could have been one-time funds. You make a hire that you don't know how to pay in the future. RCT specifically submitted 2 applications to the $600,000. One of those investments was making our recruitment and supervisory efforts more cost efficient. We invested in administrative vehicles for volunteer coordinators.
Oh.
Volunteer coordinators have historically done everything from going to recruiting events to doing vehicle inspections to going out into the field to field complaints or do ride-alongs with people, all in their personal vehicles at a federal reimbursement rate. So being able to put them in an administrative vehicle without reimbursement brought the cost curve in all efforts, whether it's administration or recruitment, significantly down. The other effort, which I'll leave to Bobby to cover more thoroughly, was trying to create a more universal and accessible training platform for volunteer drivers. That is a big burden. Is one, how do you make sure that this is done comprehensively as well as consistently across all of our volunteers? So we, working with St. J Academy students in the film, are actually creating with all the other volunteer coordinators across the state a training video for those initial trainings. Where I think it's important to kind of discuss the future of this investment is how do we sustain that capacity? It's not one of those things where you can go out and make one-time gestures. Obviously, with the investment in becoming more efficient in those efforts with some of those funds, that is an investment that sustains over the lifetime of the vehicles. But being able to continue those investments and those efforts are going to require sustained investment within that program. So any future investment I would imagine, and again, this is the determination of VTrans, go into a similar competitive program where individual agencies could put forward competitive ideas or bids that show and can be measured in how we can increase that volunteer recruitment effort. At the end of the day, investing in volunteer recruitment is investing in the capacity of our agencies to continue to provide rides. Chairman Westman, framed it perfectly when he said there's a number of different aspects that are going to be happening in the next year. Whether it's healthcare consolidation, whether it is federal changes in Medicaid eligibility, whether it's refinement of the O&D program under their financial constraints, the best investment you can make is within the capacity of the agencies within your state to be able to provide those services both efficiently and effectively with fluctuating patterns. So an additional investment would allow those competitive ideas to continue to be funded as we increase that capacity. The other thing to consider is once you've increased capacity, what's the next additional step? So how can you kind of take that additional step beyond the investment in volunteer recruitment and increasing that capacity? And that's making the capacity you do have more efficient. So, I really want to recognize the impact and the efficacy of the $600,000 investment. I would certainly advocate that you continue that investment in a competitive bid process so that the best ideas continue to rise to the top in a measurable way. But I would kind of encourage you to consider the next layer of that, which would be mobility management. And that feels like a really kind of one of those terms that only the transportation providers would say in front of you. But what it really means is putting an intense focus on best utilizing your capacity to most efficiently and effectively give trips. So having that individual who can develop the relationships with providers to think about scheduling the work of Section 28, continuing that effort, but really looking from a 30,000-foot view of how do we take the 13,000 trips requested for the day at RCT, form those partnerships with healthcare providers, with care providers, and I'm drawing that distinction between the healthcare industry and the individuals within the homes of those needing services, and connecting all those dots to put those vehicles, those volunteer drivers, to the most efficient use of coordinating across the state.
Go ahead.
Thank you, Mr. Chair. So on that point, we had the public meeting or joint meeting where we talked about the outcomes of the work that you had done, not just you, but it was a committee or a task force. I don't remember the exact titling, but what I took away from that was we should focus specifically on that problem, which is how are the hospitals, how are the healthcare providers actually scheduling their appointments to support you not having, as a transportation provider, bouncing back and forth at random times when you could be having multiply stacked appointments. And the report seemed to show that there were ways to move us to that, like especially around dialysis, although you had pointed out that heartbreaking story of the person who, if not more than once, at least once, had a cardiac event because of the difficulty of that travel. So that is where I would like to invest our money and time if we can, because that was the most compelling piece coming out of it. So is that what you're describing when you're saying mobility management, or is that a totally different concept?
It's an aspect of it. And I think it's really important to recognize that Section 28 gave a great opportunity for us to have a broader conversation as to efforts that were already happening. You can't go a day without having those conversations with hospitals about, we're going to have a vehicle here, but really holding everybody accountable to that shared dialogue. So I think healthcare is a critical piece of mobility management. I can proudly say that in our month and a half of providing services in Franklin County, we've gone from 3 of 25 dialysis clients going to their services in a shared ride to about 16 or 17.
Oh, wow.
Which is, I think, provides a better experiences for those who are going through difficult times, have a shared experience and be able to kind of create that journey together. But it also creates greater efficiencies. But under the braided system, it's not just healthcare. I mean, obviously, those are accountable partners who are here and who you can call testimony, but it's also things like grocery trips. It's working with adult days. It's figuring out, how can we work with human services, healthcare, our nutritional access programs, all those types of opportunities within the braided system bring value beyond just the healthcare providers. But I think the healthcare does have a critical place given the direction our healthcare providers are going, with places like birthing centers closing, with consolidation of services, with privatization of critical care services. All of those are going to prompt a critical and urgent conversation as it relates to healthcare.
Kind of related to, what Snyder Westwood was saying at the beginning with consolidation.
Thank you. This is great. Thank you so much. And I'm so glad that the two committees got together and asked you to do this. And I'm really happy that it's working, and thanks for your leadership. Couple of questions. So when you talk about mobility management, I start thinking about access to education, access to workforce. That's probably in the future, or maybe in the future, but the more we can get folks as part of the system, and there might be other revenues in those other areas. So you don't need to talk about that if you don't.
No, I think mobility management really boils down to the interconnectivity of the services we provide.
Yeah.
So if it means, childcare, if it means education, if it means mental health access, one thing we never talk about is access to the court systems. How do you make appointments in the court dates? All those types of things. And you see it this is going to sound redundant, as a microcosm in some of the microtransit service, is you have this low barrier service. And when I say low barrier, I mean the trip and the individual do not need to qualify. They just have access. And you see the fluidity of the services. It's meeting a friend for lunch, but it's third place, preventative health care. It's
It's taking me from the top of the hill to the bottom of the hill.
there you go. It is that diversified demand that really gets included in that. And I think a critical aspect of the mobility management is not just working with providers or capacity or riders, but dealing with those situations which make our our efficiency algorithm more difficult, right? You have mental health. So the human health and social services, an individual may not be able to ride together because of their mental health challenges, behavioral interventions, all those types of things where a mobility manager can help work through those cases to make our kind of larger automated systems much more efficient by working through those individual circumstances.
And then just one other question. So you're probably doing this, but if you could just keep alert to places where you're sending a lot of people back and forth between two, like between two hospitals, for example, where a fixed route or a semi-fixed route might make sense and be less expensive.
Yeah, I think there's opportunities for, I think the challenge of the funding system is that those fixed routes are kind of this enormous barrier. And I think it leads to, you want to hold on to those once you've accomplished creating the case for a fixed route, because the possibility of a new one in the future, but being able to be responsive. And I think what is often think of as a fixed route is often determined in ride sharing, right? Like Franklin County, we may take 20 different individuals to substance use disorder medical assisted treatments. And is that a fixed route, or is that efficiently right? And so I think it is happening to a certain extent, maybe just under a different taxonomy.
Right. And I think it's probably better if it has a different name. And because then it could have multiple sources of revenue.
Yeah, and it's more specialized and determined by the individuals as opposed to having an empty bus rolling and individuals don't do that.
Thank you.
Okay.
And this would title Medicaid transport, but everything you said would be for OD and other non-emergency medical transport, and the volunteer drivers participate in all that.
That is the beauty of the braided system. I will say that one of the challenges of volunteer both recruitment and management is, satisfying the compliance and the regulatory demands that are related to Medicaid specifically, right? That is the highest threshold, and Bobby can speak more specifically about kind of the administrative challenges, both in documentation and mileage tracking, reimbursement, and just eligibility. Oftentimes when we go to agencies with large volunteer pools, by the time they hit the end of the Sinky charter or Plinko board of eligibility of all the regulations, you may have one or two people who actually can.
And that's the background checks and all that kind of stuff. That's
Right.
federal.
Yeah.
You do that though anyway for the O&D programs, like the background checks and shit?
Yeah, we maintain that, but there's also vehicle inspections. There's insurance requirements upon the individuals who volunteer.
That you impose just because it's a smart thing to do, not because there's a federal.
It is required under the contract, yeah. A certain level of insurance coverage.
But that's what you do just to protect yourself, not because of like on a non-medical transport. If you're taking somebody to an adult day, you don't need to do the same kind of level of background check and requirements that you do for Medicaid.
So typically because we are graded services and you never know with funding source, yeah, we default to that baseline. I think there are opportunities to think about volunteer reimbursement rates for O&D or other programs where maybe you can have more highly incentivized, but right now it's really defaulting to that baseline.
Okay.
When you say inspections, is that in addition to what the vehicle is already, the state requirements for inspections? You have your own requirements?
Correct. So we require documentation of state inspections, but we also, so a volunteer coordinator would actually inspect for things like cleanliness and, making sure that there's not, people are entrusting us to get in the back seat of a private vehicle, and we want to make sure, and doing spot checks and follow-ups to complaints are all a critical part of that. Because those who ride with us often don't have a choice. And so I think we have a higher kind of duty standard and duty of care that if an individual has no other choice but to get in the RCT vehicle, whether it be a professional vehicle or a volunteer, that when they get in the back seat, that anyone at this table would feel comfortable doing that.
Here's what, and I love what RCT does. The overall numbers, when you give, here's our total rides, here's the ones that are volunteers. It'd be nice to have what's that for the whole system
Okay.
and the statewide piece.
Mhm.
And I don't know if this is the time that we should move into Ross and in that piece. It would be nice for us to be able to when we go to the floor, if we include stuff within the budget, within the T-bill, however this gets included, if we could paint a picture of exactly how many we've got. I think that last hearing we had, the number was thrown around, there were 17 people that we had been able to bring on board. So if you guys want to sit together, however you want to do this, we just need, and then my goal is in this, that by the end of this morning, you've talked to us about what are the physical things that we need to put within a budget or within, wherever the language ended up with the dollars to figure out what we should do. At what level could, we do to move this up? We certainly want to continue what we're doing, but what are the pieces beyond this? I think we've heard that building systems whereby hospitals, the public transit agencies collectively around the state all can talk together would be an ultimate goal. But we need to be able to physically figure out how to do this and then we'll figure out what we can afford within those pieces.
Thank you for context guidance, Mr. Chair. For the record, Ross McDonald, Public Transit Program Manager at V-Trans. And jumping off from what Caleb eloquently described as the volunteer program in 2025, 44% of all demand response trips, whether it was Medicaid, non-emergency medical transportation, O&D, and as well as the newly established program, Recovery Job Access Program, we were at 44%. Pre-COVID, we were in the low 50s. Those average trip costs were around $23, $24 pre-COVID. We're at $54 now. Some of those costs, the rates of the GSA rate is also 20-30% higher, and our own rates and wages. But it's been really helpful to juxtapose and to amplify the Section 24 volunteer investments with Section 28 coordination with the healthcare folks. And that is the nexus between capacity and mobility management. But for us, when we received the T-bill language, we immediately went out to the providers and asked for an overview of number of volunteer coordinators, number of volunteer drivers. We had 5.5 volunteer coordinators in July and 159 drivers. We used to have about 300 pre-COVID. So that's what we were talking about last year. In December.
This on, you're reading off the sheet. Do you have this on a sheet for?
Absolutely. Afterwards, talking with Caleb and Michelle,
I can't remember it because.
yeah. What I'd like to do is, hear from the committee and then follow up with a package that's responsive to you. I mean, what to leave in, what to leave out, all those questions. And with the guidance that Michelle gave us, which is deep dive on section 24. What are we seeing? Is it lessons learned? What's the return on investment? Those types of things. We'll go through that in a narrative, and then the information will come to you in the next business day or two, pending your approval. So when we went from 5.5 to 8 providers, when we originally looked at the bill in section 24, it was for volunteer coordinators hired with grants provided pursuant to this section shall be responsible for building the volunteer program. Our providers responded in a disparate way. Some said, well, we already just hired a coordinator. What we really need is more outreach. What we'd like to do is use some of those funds to advertise and to do the Front Porch Forum corridor outreach, those types of things. And so we did determine that we would inject those funds through the Mobility and Transportation Innovation Competitive Grant Program and open up the scope and scale to what those regions thought was going to improve their volunteer program best. And so as a result, we purchased some vehicles for RCT for those purposes that Caleb outlined. We invested in outreach. We invested in more coordinator positions. And based on that, in December, when we said, okay, we're getting ready for the legislative session, give us the update. There was 190 from 159, so 21, 17 increase. Those awards went out in October because of the timing of the MTI funds are generally on the federal fiscal year. And so we were using FHWA funds to help us manage those programs. And the timing works pretty well with everybody getting their ideas in order. Those scopes that we were awarded were 2-year scopes, understanding that we didn't want one-time funds to blow through and get some momentum and then not be able to fund this. And so we did ask for 2-year scopes and are proceeding that way. When we talk internally about what this means, it's difficult to assign a number on the savings that you get from a coordinator. If we receive 21 new coordinators, some are driving 5 days a week and some are driving 1 day a week. Back of the napkin calculations that we've been using is the average volunteer driver can save up to $10,000 a year if they're doing 3 or 4 days. If they're doing those Boston trips, that's saving a lot more money than if somebody's moving around in town. So it's difficult. We will be able to see when we take a snapshot of 26, how do we do in 25, and that route performance report has its flaws, but it also has the value of the same metrics being calculated for 20, 25 years that is allowing us to look at the changes through these programs. And it's not enough. When we look at demands and costs and Colchester and other places, well, it's okay. But all of our regions are trying to figure out what are those constraints? Are they okay for now? If we get 2 or 3 new dialysis patients, that's going to really change their abilities to continue the current constraints. A few folks move or drop off those roles. Well, now maybe they can do some more social, personal. And that's how we get to this point where there's so much latitude or agency to agency or region to region. Some have an incredible amount of adult day trips because they have adult day facilities. Some have none. And so we do try to work with folks to ensure a baseline of services. Is it at least 4 to 6 trips a month for medical and social, is it unlimited critical care for dialysis and for cancer treatments? Are we ensuring that people have access to food and nutrition? And then we start talking about the social personal, which was added 7-9 years ago when we knew, and all the studies showed the determinant of healthcare outcomes are as positive through those types of trips as going to the doctors. But right now we're considering that type of guidance and wondering if there's if this is the appropriate time through the advisory council, public training advisory council, to ensure that our applications that we get for 26 include the budget for a baseline to ensure this body and the state and all of our residents of those types of baseline trips that we can provide throughout the state, and then the nuance occurs. That's good, but these need more adult day trips than these folks. These people rely on a lot of social trips. How are we going to, manage those? Is that going to continue to be a priority? We also added the Recovery and Job Access Program. Those trips are for folks in recovery and or people who are trying to access a job opportunity. Nobody works that program better than RCT and connecting people to court so that they can get their license back, bring them down to across the street so that they can get their license. Those are capped at 10 round trip per person. But there's a process for us in the Department of Health where we share the non-federal match for those trips to allow for some more flexibility, because everything that we're talking about is that nuance in those scenarios that you can't capture through an algorithm or a simple program. Sometimes they just need 3 more trips, and then this carpool starts. And so we do have that latitude again. So without being too prescriptive from the agency, we're trying to maintain the flexibility while ensuring a baseline of services can be met. Now, when we say, well, have we grown the volunteer program? Yes. Has that resulted in a decrease in costs? At this point, it doesn't appear so, but we only have a few to several months in FY26 to look at. We'll get a full assessment in a couple of months. Another question is, has this appreciably changed the denial rates of folks being told, hey, we don't have the capacity for this trip or that? Since August, the average has been about 206 total denials throughout the whole system for the L&D program. Very few denials occur in the NEMT program because that's an entitlement and they get first bite at the capacity, and that's appropriate. So we go from 206 average in January, it was down to 161. It's, bending the curve a little bit, but not in a way that we could confidently say this is making a huge dent in those challenges. But it's something.
So, I get that we've handed out a bunch of grants. We've stabilized some of the services for people that have come on. There's got to be a way for you to be able to say to us in some sort of a bullet form, here's a picture of the overall grants in something short and sweet. When you tell me it will be 2 months before we'll be out of here.
Yeah.
Between now and then, we're going to have to pass budgets. We're going to have to be able to defend the movement forward with this. I don't think anybody expects wholesale savings of money in this program.
Yeah.
Here's what I'm going to tell you. I think we expect, with Medicaid cuts, with consolidation in healthcare in the direction that everything's headed, that they will create savings in the services that are out there. But what that's going to do is put pressure back on things like the public transit agencies to be able to offer more rides. If you're offering more rides, it's not going to be cheaper. And so they push over here, it's going to bump out here. And we can't provide the rides without bodies. So if you can summarize in a less than a page that one of us could read on the floor of the Senate when we're defending something. Here's the areas we've done with grants. Here's the direction we're moving to try to get more drivers, but we're just getting started. I think people get it. They need to know we're working on this issue because this pressure is going to come theoretically from as they try to create savings in the healthcare business, it's going to push back on us. So, and we need that picture well before the 2 months from today.
Understood.
And I'm sorry that our timetable doesn't fit yours, but it is the way the budget process will work for you.
Understood. Thank you, Mr. Chair. The budget discussion that I'm charged with from the agency is to support the budget that has been presented. Yes. And so for us, when we look at the 2-year investment with Section 24, if we're building that capacity and that's concurrent and that goes on, this is when we're pivoting and asking our providers, along with Caleb and PPTA's in leadership, is what does mobility management look like? Section 28 absolutely is part of that. What else can we do? What is that going to look like? We do expect to be able to use these funds to support an increased effort for mobility management. When I provide the summary for less than a page, we will outline what we plan to do with these funds moving forward. And the Section 28 recommendation that we maintain the working group is in part so that we have ready-made a group to address these dynamics through the legislative process and reacting to changes at the federal levels. In addition to that, I've met with Brendan Atwood, the policy director at AHS, and reviewed the rural healthcare transformation projects and programs. And we're considering the interagency working group on transportation so that their programs, it could be DCF, it could be DOC, it could be Medicaid. Do we have the right folks in place to identify these impacts and those related services?
I might say to you, I think from this committee's, we're going to get Jill Mazza Olson in here, and we're going to talk about where you see this fitting. And some of that, we certainly understand your constraints around your budget and where all of this is a moving target. The whole position of what happens with the 190 odd million that they're getting over 5 years in that.
Yeah.
Certainly is a place that I think if you're consolidating healthcare services, you have to look at how people are getting here. So that will be a part of her question from us as to where you see this fitting. You can't eliminate services and not. And I'm sure they're aware of that, and I'm sure they're working with you.
We are starting those conversations about when we are at the table to ensure that the transportation impacts are addressed. We did do a very good job of that with the aging in place so many years ago, and lessons learned. And so we are trying to get out in front of that. I think we have the right people in place, and that working committee with the Healthcare and Human Service Association members that will continue. So that's where we are with our current funding levels. Going forward, if we are able to save some money on some underperforming routes or underperforming aspects of performing routes, and look at our L&D committee and ensure that we maximize the Recovery and Job Access Program, I'm hoping to have some more funds for mobility management. That is absolutely going to have to be part of the process. We can have the discussion at the table, but how does that go down to the actual management of those trips and of those funds that are supporting those transitions? So, I will add that in the summary and where we are with status.
Okay.
Thank you, Mr. Chair. So just Ross, per usual, you're extremely insightful and you know a lot about your programs. So I don't have all the information that you have and you are going to provide to us kind of the breakdowns. I'm probably not going to come up with any unique conclusion to what you have already seen as you've been looking at these programs. And you might not be able to answer this, so you can punt, but it seems like the governor's recommend budget does not actually meet the needs that you're describing. And,
We're close.
okay,
We are close, Senator. The idea that a $36 million budget is, in 2020 is now 53 million. The budget committee at V-Trans has heard that we are a program of services, not projects, and that we need to sustain our successful services. And we know that in 28, with GMT Urban's concerns, that those are our concerns. And so what can we do to address those gaps, as well as our 5311 rural services? So we continue to push on those underperforming routes and the mobility management to try to be more effective with the dollars we have.
can I just ask, so you had said earlier that the ride cost had gone up 24 to what, $54?
That's correct.
So that budget change doesn't actually feel that significant. When you think about the costs that have gone up. So I respect and I love that you're good. You've got such good optimism and diplomacy. I always appreciate it. So I realize I can't pick at the question too much deeper, but I do worry that we, as you described with the federal picture, we're gonna need something. We're gonna have to plan around this topic because I think there will be less money. And with the way that AOT's budget looks for projects and the $33 million shortfall, I worry that we don't have a consistent projected revenue source for public transportation. And it sounds like from what you've described to the committee, we're going to be getting some kind of report back coming out of this conversation. And I know AOT has not taken a position on a revenue source in the past, but that's a conversation I think we need to have. So, and I don't know when we have that conversation or where we have it, or if it's happening in House Transportation, but I think predictability is extremely important for your ecosystem of services. And I'm concerned that as we continue to see AOT's budget decline, although you have described you're getting close with the governor budget, I worry that we're going to see cuts. And that's going to be an early place that we see cuts. And I want to avoid that. So I don't know how we have that conversation or where we have that conversation. Maybe it's this committee this year, but I want to feel ready for that conversation. I guess is my
Legislative reports to date, I think we're up to more than a dozen every 20 years.
Yeah.
And the good news is the current funding formula has allowed us to grow the program from $18 million in 20 years ago when I got here to the 53. With that current funding formula, it's inelegant. It is disparate around the state because some rely on all the towns, some rely on the businesses, the resorts, donations do well in some areas. But for whatever flaws, that current approach has worked to date. But we understand that all of those funding analyses show it won't take long before we're busting at seams a bit. And
we're seeing that in different providers already.
And we certainly are seeing that and appreciate the consideration. I certainly deferring to the Vermont Public Transportation Association, Steve Fogel, who's done many of those reports. They have a recommendation ready for you to consider, or a series of recommendations, but it's not part of the V-Train recommendations.
I would just ask that in relation to this conversation, I do want to hear those pieces. I was really appreciative of the long conversation we had earlier, like the long form of time that took for the workplace cameras and just seeing how it happened over so many years. I think we need to take another bite at this apple this year, even if we don't come to a conclusion. But I would like us to spend some time, and I don't know if you've been in House Transportation a bunch on this, and they're chewing on it, but
Not on the funding element.
Okay.
We've been there 7 or 8 times on, disparate items, including the budget presentation, updates on the MTI program, those
Yeah.
types of pieces.
I would like an update on the MTI program as well. But if you're coming with the budget for that, then it doesn't need to be in a separate.
So with this, I hear we need to keep the committee going. The grant program, the grants that you handed out, I'd like to see a breakdown of the budget for the grants, how much was asked for last year, and the background information about what you're doing in outreach, and what's put in the budget, what people would ask for in outreach, and then all of the stuff that deals with coordinated effort. Is there functionally things that are in this budget? What are the functional things we can get the agencies and the hospitals all to do to work together? What would that all look like? That doesn't mean that we would look to your budget to figure this out. We're just trying to create a picture of ideally what would be the functional pieces. I get in my head what you're talking about. Grants and consolidation stuff and new vehicles and and all of that. I get that there's an outreach piece to this. I get that we've got to have a group talking about where to go in the future. The big piece out there is how we spend our dollars right to get you to coordinate all together. I'm trying to create a picture of all of that. At that point, when we know what is in, what's not, but what would look at ideally, it creates a picture for this committee where we can have a conversation and say, where can we go? At that point, I really am going to ask Joe Olson to come in and talk about in the transformation vision, where does this all fit with your thinking or in her thinking? Because this is not all just transportation dollars related. This really is about the transformation of a system. And but if we don't know what to advocate for, we aren't at the table.
Can I just follow up on
Well-
that? So, something that's really important is understanding the levels of service, right? So, those fluctuate sometimes. And if the state has a required minimum, it would be helpful to know that. And then it would be helpful to know how far from that the agencies can deviate. And I'd actually like to know also what people are asking for so that we would know the demand that's not being met.
Always the tricky part. We do a pretty good job of being able to identify the rides provided. The
Right.
rides not provided, the ones who know that this isn't eligible and we don't hear from,
Right.
those are the gaps. They're a little tougher to drill down on. When we look at, the overall demand response program, our first priority is to do no harm and to maintain the braided services. And so that means that we invest in a universal cost allocation program that is part of DEVA's expectations. We didn't come up with that, but we thought that was a good idea and it would be helpful for both of our programs. The computers, the vehicles, those are the responsibilities we take on and then amortize through the cost allocation programs because we are keen on maintaining that braided service. And then for the last several years, we've been looking at those layers of needs that haven't been addressed, recovery and job access. Can we use those recovery and job access programs for DOC folks being released from crisis beds? Conversations that we're having just this week. And so the real question is, what are the agencies and human services need what do we have? What's our capacity? And how do we maintain this braided system is the first thing. The second thing is, okay, now that we've got building capacity and we've been looking to build our volunteer program ever since COVID came and went, is are there these mobility management pickups that we can find some efficiencies? And since I've been around for 20 years, when I go to the hospitals way back when, or the big doctor's offices, they say, we don't consider that. You know, we just can't. And now we are filling out questionnaires that do you have an issue with transportation, and they're trying to develop accommodations. Right now, there is probably, in addition to the critical care, dialysis, the medical treatment for substance use disorder, we are now getting far more interest and willingness to coordinate to help us advocate for more volunteers, putting our posters and rat cards for community drivers into the hospitals, working with their volunteers to see if they would like to drive 1 or 2 days a week in addition to what they do at the hospitals. And then it's that coordination piece. And then we're wondering if there's a provider or two that could provide a license or access for the scheduler to take a look and see what's available and actually have some information available so that they could help us proactively coordinate better trips and put more folks in. They were very clear in section 28, the health and human service folks, is don't forget, this isn't logistics. These are people, their level of discomfort and abilities to hang in there for an extra hour or two while somebody else is waiting after their treatment is not something that we can consider in a vacuum. And so those are the types of fruitful discussions that we're having. To expand on that, we just expanded more dollars for our consultant associated with the Section 28 report, Steve Fauble, to work with the providers and outline a work plan for the next 12 to 16 months on who are they going to contact, what are the goals, and to put that together for next steps that we can coalesce around at our quarterly meetings with this permanent working group that we're looking to put in place.
I just wanted to just be super clear. That's wonderful. I'm glad you're doing that. But the chair's list of basic information, I think, should include the level of service and who's determining that level of service.
Yeah,
So, but you know what I mean?
absolutely.
Okay.
And you'll be at the Public Transit Advisory Council as a member. And that's what we'll be discussing. What we did when we started seeing everyone's requests for their mid-year adjustments for the O&D program was a little sticker shock. And one of the first things we did was work around and ensure, what are you providing in types of trips? Well, we only had a few that were providing, a big percentage in social or vocational or something. What I found was a lot of similarities where it's unlimited adult day, unlimited critical care, 6 to 8 trips for medical and or shopping, food access, and then a smattering of social, very little vocational. And then there's the other pieces that we're losing, whether it's because there's a special scenario or the data forgot to capture, trip purpose. And so we're really close to those. What I'd like to talk with committee council about is to ensure that we all agree as a council, the baseline, and then we get the applications that this is our baseline to ensure the basics. And then this is what we need to continue our current program. And in that delta, I'm hoping to get further to continue the current services. But we will at least be able to see what it would take to ensure. $3 million budget a few years ago was $4.5 million in 26. We provided over $6 million. We're upside down, no question. And so we need to adjust our budget accordingly.
Pat?
In those, when you do that, where do you see vocational services play out? How do you see those play out?
Yeah, I think those are moved to the new vocational demand response program that was founded a few years ago, the Recovery and Job Access component. Those are the 10 round trips offered for job access. And those scenarios are varied. We also need to do a better job of mobility management with those folks. And so, as you can imagine, are we looking at carpools? Are we talking to the businesses about establishing van pools? Can they work with their employees and say, hey, we have all of these opportunities. We will give gas cards out. We will give preferential parking. Those types of demand management programs have been in place for a lot of years. We've done employer assessments and we work with folks. What we are doing in addition is meeting with hireability and ensuring that people with disabilities have the full measure of our respective programs, whether they are transportation or AHS related, so that they know their options, whether they can qualify for a special equipped vehicle, whether they can carpool. Can we work with those communities, say, hey, we need carpools coming out of our area. We're only going in 4 or 5 major directions. Let's all try to share our empty seats. So it's going to be, kind of a smattering of those types of approaches, understanding that we're not going to be able to get everybody to their jobs every day.
So when you say 10 round trips per month,
10 round trips per year, unless other arrangements or justification can be accommodated. Correct.
10 per year?
Yeah, it's really job access, not commuter program. Job access is to get your car fixed. Job access is to go to the interview, to find a carpool, to look and ask your employer, like, hey, this is difficult for us to get here. Can you share, who is coming here? Talk to your employees, put it on the bulletin board. It is not a commuter program. It is a job access opportunity. And so for somebody who is, let's say, hey, I need a ride a week for 40 weeks, that's 40 round trips. And if we are looking at that individual and have the budget and we have the capacity, we can work and provide that level of assistance. But if we just said, hey, everyone gets these trips, we will be out of money for the critical care and the other competing trip purposes.
I get that. What about you're talking the O&D program?
The O&D program is one of the 3 programs of the braided systems that we involve ourselves in. The NEMT Medicaid, the O&D program, and Recovery and Job Access program. And the Recovery and Job Access program came from the Opioid Coordination Council work around the turn of 2020. And we sat on a committee with Department of Labor, substance use disorder folks, and came up with this clarion need for more trips with access to recovery services or job access to keep people in recovery or away from, addictive type of pressures. And so far we manage that jointly with Department of Health. And they are aware of the plans of potentially removing vocational from O&D and moving it to the job access component, which is, again, that braided service. The only difference is what are we billing it for and who's paying.
And how many rides are provided?
It's a $400,000 annual program, and we haven't spent those dollars to date. It's really has revealed that the need for recovery services isn't as great as anticipated because Medicaid covers so many of those types of trips, and that there's other options to get to and from those group counseling sessions and the like. It really has been a job access piece to try to bridge the gap to get folks gainfully employed. And as I mentioned, that could be getting them down here to get their driver's license, going to a class so that they can qualify to get their driver's license. And there have been folks who have taken far more than 10 per year because of those individual scenarios where you just need it for another month And they will have a new job and they have a ride to that one. And so that's where we are.
So your objective is to move that program, the L&D program, or the vocational portion of that. So what do I tell my 7 or 8 people who are handicapped, some are blind, can't drive? What are they looking forward to?
Yeah, we have offered to work with town and meet with these individuals and to determine what we can do through the Go Vermont program. Can there be a carpool matching service? Can Colchester help us say, hey, we need carpools if you're going in these locations during these times? Please let us know and share the ride. And the idea that and hireability has been offered to meet with them to talk about their types of services and the employers that they work with. It's not so much these 7 or 8, but if that was, the next 7 or 8, how are we going to manage those expectations? And so we continue to work with the town manager and his staff and providing information. And at this point, they've been most comfortable working directly with those individuals than to have them bring them into a video meeting or in their town offices with, hireability and Go Vermont and me and all those folks. But we continue to work with Colchester through those scenarios.
Colchester, not the only one.
I know, can I follow,
They have those problems.
can I follow up on that? So, it's similar conversation to what we had with the microtransit in Brattleboro that was terminated after a year, and we might want to have the person who worked on that come in to testify, because there were blind individuals, folks who just couldn't drive at all, and they were working at specific locations. The employers did not want to pay for the service, and it was being subsidized by basically V-Trans and the provider, and it was working really well. And it was only in effect for a year, barely even a year. And with systems like that, you want to give it a little bit more time because we were getting more ridership. But it was multiple reasons for it stopping, but that was headed the right way, and that's a model that could be used in other towns.
Even though this is the most well-funded rural transit program in the country, there are tremendous gaps. We're not getting everybody where they want to get to, including folks who are in areas not served by transit who would like to get to a job. That is absolutely a big gap. Evenings and weekends, those continue to be gaps in our services. And so that's why we try to fill in those gaps with carpools and van pools and and communications with towns and those types of things, because if we were to say anybody can use our O&D program to get to and from their jobs, we'd be millions and millions of dollars short.
We do have somebody, and I would just say, we really want to understand where we're going and the pieces around this, and compare it up to your budget is to discuss the need. I would just say to you, no one is saying that public transit isn't done well, and I hear you, we're the best funded, we're the most rural state in the country by census data. And when you're spread out, it becomes an issue, particularly when systems outside of our control in the world, and particularly healthcare systems, are dramatically changing. We can't sit here and be flat-footed. It would be my hope that by the week we come back, we can have a better picture how we would fit together the working group that keeping them going, funding the grants, funding the outreach that we need to do, and how we facilitate more the coordination and push that effort along. And at that point, I'd like to be able to talk about what all the pieces are to that and get the healthcare transformation people in here to discuss. We might do that with the Health and Welfare Committee, or we might do it by ourselves. But we have limited time, and the week we get back from after town meeting, in that week, which ends on, Friday the 13th is the end of that week. We'll want to have those discussions because we'll want to have it in our head what needs to be done. Maybe not how the money all works, because the money in all of this now is, with the transformation money that is coming out of Washington. The question is, does any of this fit there? Right. And this is no attempt to criticize your budget or anything. This is trying to, in a changing world, what does the need look like?
Thank you, Mr. Chair. And I can attest that your concerns are the concerns that we're discussing internally and with our sister agencies.
And we want to be supportive.
And you've been very supportive. Thank you.
Thanks. Would you like to?
Thank you. Yes.
Good morning, Chair Weston, Senators.
Great to see you.
It's nice to be back.
Yeah.
For the record, my name is Bobby Farnes Rubio, and I'm the volunteer coordinator lead at Rural Community Transportation. And I'm happy to enlighten you on any aspect of the particular strand of the graded system that I am in charge of now. I haven't heard it said today, but last year, RCT covered 3 million miles, and 2 million, 2/3 were covered by volunteer drivers. And I started my job there as the volunteer coordinator in July of this last year. And when I started, we had 47 active volunteers, including 7 that we got from Franklin County on January. And since that time, if you include everyone who's in the pipeline for onboarding, we have 20 new volunteers since that time. So for a total of 67, and thankfully that number is increasing at an accelerated rate because we have another volunteer coordinator, Gabby Levy, based out of the Morrisville office. And she's doing a lot of active recruiting in St. Albans for our Franklin County portfolio. And so when we added those 2 counties, Franklin and Grand Isle, we increased by 40% the number of people that RCT serves. And I could give you lots of statistics, but I'm also ready to answer any of your questions about what it's like, to manage a pool of volunteers.
So you're at 67 now. Some of that increase is because you added territory.
Well, there were 7 at the Franklin County office, so we had over 20 at the other 2 offices, and the other 3 offices, including Morrisville. So, we're ramping up. We've lost a few. I've had to dismiss a few drivers. We've lost some who leave for the season and they are taking care of parents. So there's always a back and forth. It's never going forward. We're always losing some, and
But
Chairman West, can I make a quick point?
sure,
Just as you review the statistics that are provided by the state, that is a net increase in volunteers. And I think that's
is from the net is from where?
so the numbers that you have been presented and will be presented in this fact sheet, or the fact sheet that Rob
Yep.
Mario put together, are a net increase across the state of volunteers. Bobby can speak more specifically that your $600,000 investment in the volunteer program
Yep.
has not only increased the capacity through net volunteers, but increased the quality through additional supervision, which requires the loss of volunteers and results in a much less impressive net number, but a higher quality. And I think the gross increase in volunteers is much more substantial than
Because I'm kind of looking at if I did 7 and I did 47, I'm at 54, and then and you're up to 67. It's all in the right direction.
Yeah.
And we're moving in the right direction to do all of that. We just need to tell a story.
All right. Well, when I got into the job, I expected that recruitment would be my number one occupation, and I've done a lot of that. But the maintenance of the volunteer pool is a bigger part of the job than I had expected.
Yeah.
I would say on a daily basis, about 25 to 30% of my time is spent managing issues relating to complaints from riders or complaints from drivers, making sure that certain people aren't paired together again. I mean, we offer the volunteers a pretty big promise, which is that they get to bespoke manifest, they get to choose the days that they work, and that's a lot of trouble for our dispatchers. So there's a lot of particularities. Every person has a list of things they can and cannot do, when they can or cannot drive. And when I started the job, most of the information was kept in file cabinets or on this one major spreadsheet that was shared by many people. And I'm very happy that I was able to get all of the records digitized onto an HR platform, that I can use my phone to see everybody's driving record, performance record. We created something called the driver
You're
performance
making
record.
me smile.
The paperwork load has been severely reduced, and everything is in an app that, you know, is very protected. Only a certain number of people have access to this information, but we can look up driver's licenses, insurance forms. And one thing I like is the performance record that we've created, because it allows for positive and negative situations. So accountability for our drivers, and they can't say, "Oh, nobody ever talked to me about this," because now we have it available on a list. So I'm happy to give you particular stories of things that I've dealt with. But that Bamboo HR platform that we're using, Marble Valley has also adopted it, and I helped their volunteer coordinator, Christy Bloomer, implement that, working with that company, because we had to have the database tailored to our needs, because it's usually used for paid employees and has things like paid leave and all that built in. So yeah, but that's.
Go ahead.
What would you, thanks for coming in, it's helpful. What would you say is the one thing that we could do to get more onto drivers?
Spread the word. I even brought some of the rack cards that V-Trans has provided me. If you don't have them, I have
I've
enough.
seen the posters.
But it's not like people aren't saying, I would do it if I got paid or had higher compensation per miles, or if you didn't give me such a hard time with my dirty backseat. Like, it's not,
Yeah.
it's really just letting more people know about the opportunity to volunteer.
Well, I've been very careful how we describe it in our, job postings, because that confusion happens. About 1 out of 10 people still think of the job, and they're like, "So what's the salary?" I was like, "Well, I thought it was clear, and it's a volunteer position with reimbursement." And then there are folks who are skeptical. They don't believe us when we tell them that this doesn't count as income and that doesn't go against their disability and other benefits. So sometimes there's a little bit of incredulity, but I still find that most people don't even know what we do, and they see RCT's buses and they see the beautiful wrap in our logo, but they don't realize the strength of the volunteer program.
Yeah.
Go ahead.
When I learned about the volunteer program a few years ago, I was really surprised, because it's not a usual program, I don't think, in other states. And I actually had a concern that maybe we weren't doing enough for them. But then I learned that there are a lot of folks who don't want taxable income. And the reimbursement is good, and they appreciate helping people and getting to know folks. So it's a great program. So I'm glad there's more just administration and professional administration on it, so it's not random. And I'm hoping that's gonna go to all of the other agencies as well. But it's a really good program, and it works for Vermont particularly.
Well, thank you, Senator Harrison. I would like to say that the 2 vehicles that we were able to purchase with the MTI grant that we received have this logo on the hood and the rear window, and a QR code that leads to our recruitment page with an application. So I've tested it. You can even scan it from a moving car on the highway. Not as a driver, as a passenger. But the goal was that everywhere we drive, even when we're parked in front of a Price Chopper recruiting, the car itself is a recruitment tool. And so we were able to collaborate with V-Trans and the Go Vermont program to get sort of co-branding on the vehicles. And the other MTI grant that we received that Caleb mentioned earlier is for the training video. And I was able to convene almost all of the volunteer coordinators around the state because I want them to use it and not just to be RCT specific, but I want it also to be funny enough to hopefully get some legs and maybe go viral if we
Oh,
if-
do it.
and just let people know that the program exists. And you know, that's part of the goal of what we got with the MTI grants is to spread the word. It's great.
When do we
Did
get?
Senator White put it on me?
Yeah, exactly. I'm like, when can I share this video? Do you know when it's like gonna come out?
So we're in the planning stages now. We're hoping to shoot once the school kids get out because our goal is to use the local high school students that are in video production as part of the crew. They get a production credit and even they might help spread the word once they've been part of this. And, you know, I'm looking for not too silly, but very relevant and also using it to teach our drivers how to use the upcoming HVSS reporting system, which is important to me because the portal and the route maps that we use currently is probably a lot of my time. Probably more than half my time training new volunteers is getting them up to speed with the software. And I've instilled a moratorium on the old paper system. So we have drivers that would quit before they would want to learn how to use a website. But any new drivers that we recruit, we tell them they have to report electronically, and that reduces the workload and the paperwork for our dispatchers a lot.
What is the minimum age? Like how, or what age can you become a volunteer driver?
Oh,
21?
18 is I haven't seen a hard and fast rule, but that's the rule I work with.
Do you have any young drivers?
Nobody that young. Our youngest driver right now is in their 30s, but you know, we've been trying to recruit in places where younger people might be found. But you know, I'll be honest, the greatest pool of our volunteers are retired folks. That we have a high proportion of veterans.
The fact that they can earn income without affecting their social security benefits, I think would be a big.
Absolutely. Yeah, we have drivers that make hundreds of dollars a day. We've had drivers that could make $1,000 a week, tax free. So that's an incentive too.
Well, I have, we, in the small town I live in, we have, a housing, it has a little over 30 units in it. And a bunch of people drive each other, you know, in that. And they're in the early 70s and they drive the other people that are older. If they knew about this and they knew they could get mileage in it, they'd be on the road way more than they are, you know, and they would spread out from the little housing development that they're in and do that. It, you know, it is, I think, a lot of getting information out there. And even what they get paid is so economical compared to everything else. And it's just, go ahead, Pat.
Well, I'm not sure if this is a question for Bobby or for Caleb, but in regards to the island, you mentioned expanding into Franklin County. Does Cider take care of the volunteer drivers if there are any in the islands, or do you?
So the way we've set it up with Cider is that they're sort of like a subcontractor and they manage their own pool of volunteers.
Okay.
Although we do recruit in the area that Cider might serve, so we would just send those applicants to Cider for them to handle in their own method.
But
But
they would take care of it.
yeah, but they follow the same rules and background checks that we do. So it's essentially the same.
Okay.
And that the Cider number was not included in the number of volunteers. So
And then have you had trouble with background checks? You don't have to do fingerprints, or do you have to do fingerprints?
no, just the background check involves, you know, the Department of Public Safety, the Child Protection Registry, and the DMV. And then we have
It's just one check, or do you have to go to each one of those?
no, it's well, our HR person manages but for the person, it's just one application. It's 24 pages, about 15 of which they have to fill out. It's a part of the process. So we do that during the interview phase. And one of the coordinators, myself or Gabby Levy, will make sure before they leave, everything is filled out correctly. And that's, you know, that's a net that catches a lot of problems
Yeah.
for, you know.
And you have to pay the whatever it is, $35 or something.
Yeah, that's
$30.
yeah. And so, you know, there's a cost associated with background checks, but that's the first step. And then once they pass the background check, then the next stage is a 2-hour in-person training, the 4-hour online training, and then the final step before we let them fly from the nest is a drive shadow where we go out with them for a typical day.
So the state police does charge you for the background check?
You know, I'm not fully sure of that because I don't handle the actual processing. I just get them filled out and our HR manager runs the background
They
check.
never did get us that list.
Yeah, it'd be good to know because we're talking the criminal record background check fund has a deficit. So the question about raising the fee, but we're thinking like, we're just raising the fee, but then we have to pay more money for a state.
If we have to pay you to pay them to, and, you know, who's paying?
Well, perhaps we could be exempted from that charge, given what we're.
Or at least not pay the increase, like the money should come from someplace else, but you don't have delays, like it's working, as far as from your knowledge, the system's working, like it's not a problem.
Oh, I'm happy to report that Vermont was the quickest state, and usually 2 or 3 days, but we'll find out. But if they've lived in other states, New Hampshire, New York, it delays it by weeks sometimes. So it's just, I'm glad when their only addresses are in Vermont, because I know
And it's how far do you have to go back?
7 years. So any address they lived for 7 years. And we have drivers that have New Hampshire driver's licenses, and New Hampshire is a little funny about handling those requests because they won't send the documents to us. They have to send them to the driver and then they have to give them to us. So it just creates another hurdle.
That's great. I think at this point, then, you know, unless you have anything else you'd like to add, we're gonna take a 10-minute break.
Well, I'll just quickly end with, one of my first recruits said that you'll need every walk of life in these rides. And I'm always telling our drivers that not only are they providing a service, but they might be the only friendly face that our clients see the whole week. And so a lot of drivers take that very seriously and they give some pride. And, I will love to hear the reports, get lots of positive compliments, probably more than we get complaints, which is always nice. And I have a place to record them. So, thank you for your time.
You're always gonna get a handful of complaints, and they're the ones that will stick out in your mind. You just have to think about the majority that are happy.
And no news is good news in this world. There's a void exactly the same shape as the poster I brought for our community driver program.
Yeah, I don't know if you'd like it. That would be great. That would be great. Thank you very much.
Thanks for your work.
Yeah.
If you could take us offline, we'll be back at 11 and we'll